Hi, my name's Dr. Jo Beswick and I'm a senior lecturer at Staffordshire University. My specialist area is healthcare law or medical law and ethics, and I spend much of my time considering the law and ethics which relate to healthcare, and that really is a very broad remit, right from the beginning of life and even prior to the beginning of life, bringing life into existence. So access to IVF treatment, the ethics or otherwise of cloning, the legality of involving a third party such as a surrogate into a pregnancy. And once we've got the life, then obviously there's lots of issues that occur during a person's lifetime, and that can be access to medical care, consent to their treatment. Are they being told the information which they want in relation to healthcare? Unfortunately, sometimes medical negligence and breaches of medical confidentiality can also arise. Okay, the 7th of April 2021 is World Health Day, and the organisers, the World Health Organisation, have asked that this year we focus on building a fairer, healthier world. I decided to focus on what is perhaps the topic of healthcare at the forefront of many people's minds at the moment, and that's the COVID-19 pandemic. There have been questions about deciding for vaccination where an individual can't decide for themselves. Just last week we had the first decision from the courts where a young man with severe learning disabilities was due to be vaccinated because of his disabilities making him more vulnerable to COVID. The medical team were very much in favour that he should get the vaccine, whereas his parents and carers were of the opinion that he shouldn't be vaccinated because of concerns about side effects from the vaccination. Now, when we're looking at what might be phrased an incompetent adult, so an adult who isn't able through either permanent or temporary impairment to make their own decisions, we do have the courts, that is, the power to make decisions in an individual's best interests. And it was decided in that case that the young man should receive the vaccination. Now, the courts only have that power where they are dealing with an adult who lacks capacity or a child. They certainly don't have that power when looking at competent adults. And one thing appears clear when each age group is invited forward is that there's not 100% take up. So there are individuals who are electing, for whatever reason, to not have the vaccination, and that there's no question of compulsory vaccination. Although there's no question of compulsory vaccination, one of the very persistent phrases that we've kept seeing being raised in the press is so-called vaccine passport. From a practical perspective, what is meant by the term vaccine passport is that those who can prove that they've had the vaccination might be allowed to do more things more quickly than those who haven't had the vaccination. The two examples that are often given are that the right to travel abroad might be limited to those who could prove they'd had the vaccination. The other one that's often given is that attendance at big public events, so sporting events or music concerts again should be limited to those who have had the vaccination. And this raises big ethical questions, and not least practical questions about how you would at the moment prove you'd had the vaccination. So there's the issues about being compelled, the vaccine passport. But the irony of much of this debate is that it is very much a luxury reserved to individuals in certain countries. America, Australia, the European nations have reserved a far larger percentage of the vaccines than they could actually ever need. So that leaves some of the poorest countries and states in the world with little access to the vaccine yet. Now, some of the vaccine makers have indicated that they're going to donate certain numbers of vaccines to such countries who wouldn't be able to buy them for themselves. But even with such generous donations, it does seem that the populations there are not likely to be vaccinated this year, or only a small percentage of the populations in such countries vaccinated this year. Now, there will be some of you watching this and saying, well, is that a problem? As in the UK's problem. But that's the thing with COVID-19, and particularly if we want to return to international travel, that we've got to think of a whole world view. And as what happens in one of the poor countries could immediately affect what happens here.